Good day, I'm Stephen McHugh, and this is your JIS news for Wednesday, February 3. Jamaica is now set to receive its first shipment of COVID-19 vaccines within a few weeks. The vaccines from the WHO COVAX facility were previously scheduled for delivery in April. But Health and Wellness Minister Dr. Christopher Tufton says that timeline has been sped up.
We have been advised, Madam Speaker, last evening, by the COVAX facility that the country is set to receive between 146,400 and possibly up to 249,600 doses of the AstraZeneca vaccine by the middle of February 2021. This means that some 125,000 Jamaicans, or up to 125,000 Jamaicans, could receive vaccines during the months or the latter part of February into March.
Dr. Tufton made the announcement during Tuesday's sitting of the House of Representatives. 16% of the population, or 450,000 Jamaicans, will be targeted for vaccination under the COVAX facility. Frontline workers, including doctors and nurses, as well as vulnerable persons 60 years and older, are among the first groups who will access the vaccines.
I must hasten, however, to caution that it is likely that the allocation could be adjusted. It could be adjusted upwards or downwards, depending on the present global circumstances and any anticipated challenges that this facility may encounter, which most likely would be issues around manufacturing. But to date, so far, so good. The commitments have remained true, and this latest correspondence that we received only yesterday is an indication of confidence in the process to deliver on the commitments that we have signed on to.
Dr. Tufton says preparations to receive the vaccines are on in earnest. Indemnity and liability frameworks with AstraZeneca are being finalized. Meetings will be had in the coming days with the National Vaccine Commission and the National Coordinating Committee to introduce the first set of vaccines to the country. A virtual meeting will also be held on Sunday, February 7, with private practitioners from across the island to discuss their role in the distribution of the vaccines among high-risk groups. Another virtual town hall meeting is set for tomorrow, February 4, to brief the public. Industry, Investment and Commerce Minister Audley Shaw is encouraging all labs to become accredited for COVID-19 testing. The Jamaica National Agency for Accreditation, JANAC, has launched a pre-accreditation approval program to increase stakeholder confidence in Jamaica's COVID-19 testing capacity.
JANAC's international recognition for the accreditation of medical and testing labs will provide the assurance that the results generated by these entities can be trusted, Madam Speaker, thereby facilitating trade and protecting consumers' well-being.
In the meantime, the industry minister says the National Compliance and Regulatory Authority, NCRA, has strengthened inspection, monitoring, and enforcement activities in response to the COVID-19 pandemic. Up to January 31, there were 68 compliant hand sanitizers on the market, with 8 importers and 5 local manufacturers of hand sanitizers registered with the NCRA.
Over 104,000 products were detained at ports of entry. And after inspection, Madam Speaker, testing and analysis, 54,000 were compliant. Of the 104,000 tested, 54,000 were compliant and released for sale.
The Bureau of Standards Jamaica, BSJ, has also issued calls to manufacturers, distributors, and importers of hand sanitizers to take in samples of their products for testing. Users, manufacturers, and distributors of infrared thermometers are also being urged to submit them for calibration and accuracy checks. Also coming out of this Tuesday's parliamentary session, Minister of National Security Dr. Horace Chang has reaffirmed the state's commitment to adequately equip the security forces for crime fighting. He says interventions include improving police communication, expanding Jamaica Eye and training facilities, procurement of technology equipment and vehicles, and upgrading of the forensic lab.
In the terms of institution, rapid response teams, SWAT teams, special ops teams have been set up. Border control with the MAC Brigade and JDF is fully established. And as a result, we have more gangs in courts. We have expanded training facilities.
Minister Chang also urged parliamentarians to support government's plan Secure Jamaica.
Support the measures that give additional powers to the work of the police. To approve bold and innovative laws, policies and regulations for improved security, and make the investment necessary for national security to overcome decades of neglect.
We will support the legitimate efforts to make Jamaica safe. We all want that. None of us are happy with the current situation. All of us are affected by it.
More Jamaicans will now have access to judicial services following the opening of a justice center in August Town. Portfolio Minister Delroy Chuck opened the center yesterday. He says it will increase the rate at which residents in the surrounding areas can access justice and resolve conflicts peacefully. Minister Chuck also says restorative justice has been providing positive results in violence-prone communities across the island.
We think that restorative justice is a strategy to resolve disputes and conflicts in Jamaica. And if it is adopted at all levels, in the schools, in the communities, across neighborhoods, across parishes, we have no doubt that the violence and the murders that we experience could be substantially reduced.
The ministry is now operating 11 justice centers and 7 restorative justice centers across the island. Restorative justice encourages reconciliation between victims and perpetrators of crime towards a peaceful resolution of conflict. And finally, elderly persons 75 years and older are set to benefit from a new social pension program by the Ministry of Labor and Social Security. The new pension program will provide $3,400 per month to each beneficiary and index benefit levels to half of the minimum pension under the National Insurance Scheme.
To qualify for this new pension program, the individual should not be a resident in a government institutionalized care facility, should not be in receipt of social assistance through PATH, Poor Relief, or the National Insurance Scheme.
Information Minister Favour Williams gave the update at this week's post-cabinet press briefing. She also revealed that Cabinet had given approval for increased benefits to government pensioners with effect retroactive to April 1, 2020.
Persons who receive up to $41,667 per month will now receive an additional $2,300 per month. Persons who receive between $41,668 to $54,167 per month will now get an additional $1,800 per month. Pensioners who receive between $54,168 to $83,333 per month will now get an additional $1,450 per month. Pensioners who receive $83,334 and over per month will get an additional $1,450 per month.
And that's it for JIS News Today. I'm Stephen McHugh. Thanks for watching.